I'd like to use my time today to draw attention to the ongoing difficulties with homelessness, its interaction with addiction issues and how these have been impacted by the Covid-19 pandemic and its resulting restrictions. In the early days of the virus, there was a necessary and welcome urgency in government to address the homeless and housing crisis, while individuals and families were asked to lock down in place. And indeed, last year between April and May, there was actually a 12% decrease in people in emergency accommodation. Unfortunately, since that time, the numbers of people seeking support have gradually crept up towards pre-pandemic levels as the ban on evictions was lifted and the cost of living in particular, and we all know this, rents on housing has soared. The number of people in emergency accommodation has reached the 9,000 mark for the first time since April 2020. As the world moves to a post-COVID reality, it's really imperative that as a government we don't allow a return to the norm of the last few years in terms of the numbers of people who are in homeless accommodation and emergency accommodation. It's absolutely vital that every department of the state works to ensure that the long-term homelessness is considered completely unacceptable in Irish society. We know for certain that long-term stays in homeless accommodation and long-term stays in emergency accommodation lead to worse outcomes for those receiving services, and that itself places great stress and demand on treatment and counselling services. Outcomes for people in emergency accommodation will not and cannot improve unless they have access to secure long-term housing and to appropriate support services. There are a couple of issues I want to raise in that regard. Firstly, the provision of dedicated LGBTQI+ emergency accommodation within homelessness services. A recent study by Focus Ireland, Belong To and UCD suggested that some LGBTQI+ persons experiencing homelessness were actually unwilling to enter a space such as a hostel or an emergency accommodation venue where they feared that they would encounter a lack of understanding. And people do deserve to feel safe no matter what services they're accessing, and we may need to have dedicated housing for that purpose. Secondly, the COVID-19 pandemic raised grave concerns for people who are homeless and use drugs. In March 2020, in light of the pandemic, the HSE published, and it was welcomed, a plan that guided the support and treatment of substance use and recognised that harm reduction interventions for substance users were necessary. People experiencing homelessness who were substance users were offered support to both reduce the risk of contracting the virus and reduce harm from drug use. And I would echo Deputy Creed's call that staff who worked in high support services should also be recognised in that recognition payment. But the two major initiatives that were undertaken were the faster processing of clients into treatment and temporary amendments to allow patients to access ongoing treatment and regular medicines, which was fantastic, and I hope we can hold on to that. However, the one area that we did not significantly address is the continued dichotomy in Ireland between treatment for addiction and treatment for mental health. Service users often have to choose which treatment route they will take as we continue to separate out those two issues despite best practice. You can't get psychiatric care till you treat your addiction or vice versa, and of course life doesn't work like that. The proposed Drug Citizens Assembly would be an ideal opportunity to discuss that lacuna. For the most part, from what I'm hearing, service users and providers agree that there have been some positive changes made during the COVID-19 crisis that should be maintained, but we have a lot more work to do, and in particular on mental health.